Welcome to Your Infinite Health. Are you getting older?
Are you feeling it?
How would you like to do that in reverse?
We're your host,
Dr. Tripp
and Lene.
We've run an integrative medicine practice for 13 years.
Together, we have 60 years of combined experience helping clients.
We've helped tens of thousands achieve success in health and live longer, happier lives.
In this show, we'll cover peer-reviewed and evidence-based integrative approaches to creating the health you've always wanted.
We also share professional experience we see in the field every day.
So if you're ready to feel, look, and live your best life, you're in the right place.
Welcome to Your Infinite Health podcast.
Hey guys, Lene here. Thank you so much for tuning in today. Tripp and our guest for today will be joining us shortly, but I'm kind of impatient, so I wanted to hop on here and tell you a little bit about our guest. His name is Reed Davis. He is a board-certified holistic health practitioner and a certified nutritional therapist. He is an expert in functional lab testing and holistic lifestyle medicine. The founder of Functional Diagnostic Nutrition, aka FDN, and the FDN certification course with over 4,000 graduates in 50 countries. Reed served as the health director at a wellness center in Southern California for over 10 years, and with over 10,000 clients is known as one of the most experienced clinicians in his field. Reed serves on the advisory board of the American Natural Wellness Coaches Board and the American Association of Natural Wellness Coaches. He lives in the U.S., and when not teaching the FDN certification course and helping his graduates build their private practices, he's usually found gardening or riding motorcycles. As an environmental paralegal throughout the 90s, Reed was saving the planet, including the birds, bees, air, water, and trees that rhymed. In 1999, he turned his attention to what is the environment doing to people, including me. That began a 20-year career dedicated to helping people find out what's really wrong and how to fix it naturally. After earning a certificate in nutritional therapy, Reed noticed that most patients had already seen multiple doctors and therapists and still had many of their original complaints. Reed decided then that he would be the last practitioner anyone needed to see and became an expert in functional lab assessments. FDN is the result of more research and experience than most practitioners get in a lifetime. Reed Davis is one of the authors of The Gap: Simple Steps to Reclaim Your Health and Reverse Most Chronic Diseases. This book is the missing link, the piece of the puzzle that holds the answers you've been searching for. It's the gap between chronic disease and your true recovery. Thank you so much for joining us today, Reed. All right, Reed, thank you so much for spending some time with us on Saturday. Appreciate it.
Very much my pleasure. Be here with you, Lene, and Dr. Tripp.
Yeah, cool. Well, just so our listeners know, can you kind of go into your origin, well, I call it your origin story, but like, what was the path or the spark that inspired you to do and show up as you do today?
Oh, thanks so much. I was in a different profession in the 90s. I was actually in environmental law and conservation of the planet, everything from air, birds, water, trees, bees, and so on, saving the planet, so to speak. But I started getting really worried about people. I saw how bad the flora and fauna were doing. And I thought, what about people, including myself? I was in good shape and good health, I thought, and didn't have any problems, but I still didn't want anything sneaking up on me. So I just switched jobs. I went from senior VP of a recycling company, basically, to janitor at a wellness center. I'm just kidding. But no, low man on the totem pole for about 3 weeks until I took over the whole place.
Wow.
I'm still kidding. I had so much fun doing this, and just what a wonderful opportunity I was given there at this wellness center, Southern California, all alternative health kind of thing. We had doctors, but they were all kind of quirky, and chiropractic and acupuncture and things. They gave me the opportunity to help people and any way that I could. And I just loved it. I immediately enrolled in a nutrition school. Matter of fact, the owner took me with her as her assistant. She was getting her diplomate in nutrition for her licensure and said, hey, you can work on patients in between classes if you want to come to this. You'll get a certified nutritional therapist out of it. And I jumped on that they say, like a duck on a bug, and got to work with people out of the gate. And so I was just amazed at a number of things, and I learned a lot. I had an awful lot to learn, as you can imagine, but I had nothing to unlearn. I was kind of a blank slate, just wanting to help. And what can I do as a lay person? And, I was a professional, but never worked in this field before. I'd read a lot, and I'd taken good care of myself. But what I noticed immediately, and then I'll kind of wrap it up, with the people coming in were just sick and tired of being sick and tired, and they'd been through the mill. And I called that right away a cycle of trial and error. Most had seen 6, 8, 10 or more practitioners already, and they weren't better yet. And I just thought, hey, what a ripoff. I just said, wow.
Foremost, yeah.
I thought that. And I thought also selfishly that, boy, if I could help these people, I could probably do well for myself and for the clinic that I worked for. But I also wondered, and I live in Southern California. I live out in the hills and near the desert, and I ride a motorcycle all the time. And I'm out there on my bike, totally free and healthy, and just thinking about these poor people back at the office who are putting their health in someone else's hands. That's what kind of disturbed me the most, or nearly the most, was that, why aren't you taking responsibility for your own health? You have a complaint, do something about it.
Exactly.
Well, the truth is they didn't know what to do. There was no guidance. There was no wall for them to put their ladder on. The wall they had their ladder on was medical. And most of them didn't really have medical problems. They had lifestyle, just poor nutrition, poor sleep, lots of stress, and all these kinds of things. And so that's where I went to work. And fortunately, I'll kind of summarize how I got to where I am now. I spent 10 years in that clinic, 10 years working day in, day out, face to face with Mr. Jones and Mrs. Smith, running laboratory work. I was allowed to do all this lab work, and it was all alternative. It was at my own direction. I had great mentorship there, but it was me exploring and running these quote unquote alternative labs and, getting the patients there to spend their hard-earned money on it. So I had to also perform. I had to, I couldn't waste their money. So the theme became, what's really wrong with you? I don't care about your diagnosis, Mrs. Smith. I'm not a doctor. I don't know anything about fibromyalgia. I just want to tell you, you've got symptoms, and there's got to be underlying causal factors. So let's look at the labs that way. And they agreed, and I looked at them that way. And again, I had good mentorship. But over 10 years, running thousands of labs on thousands of people, I also recognized my own patterns, and I recognized who got better and who didn't, and why. And the last part of the puzzle, or another important part, is that I couldn't write them a prescription. Thank God. I had to give them things to do themselves to be responsible, back to the self-reliance. And so I would always ask, what are you doing at home? What's your home life like? Like, I don't know, you come in the office 3 times a week for your modalities, your therapies, that's wonderful. But what do you do all the rest of the time? Again, so the theme became send them home with diet, rest, exercise, stress reduction, and supplement strategies. And I did that running those labs, hormones, immune, digestion, detoxification, energy production, nervous system balance, looking really investigatively like a detective at the underlying causal factors. This you won't hear anywhere else hardly. Understanding how those causal factors affected each other, which is why I just call it metabolic chaos. I have no diagnosis except metabolic chaos. Woo! Lots going on in all these people. And then what they could do to sort it out. I was there to help and guide and things, but they would go home, and if they did the things that I asked them to and gave me good feedback, we could, because you have to alter course. Everyone's different. Everyone's different. There's no two people alike. And so that after 10 years of constant work, we're very busy. And so all that work. And so again, I recognized patterns and put together a program. So that, and I ended up having to call that something because I started teaching. They wanted me to teach. So I called it functional diagnostic nutrition. I just couldn't think of a better name at the time. And now we're stuck with it. FDN is known around the world. I've trained 4,000 people in 50 countries to do FDN. So there's FDNs around, and we're practitioners that follow this methodology that get to the underlying causes and sort it all out and give people things to do with very reasonable expectations that would outperform whatever the heck else they're doing. And it does.
Very cool. So, like, what would be an example? Somebody would come to see you that was stressed out, tired, not sleeping right. You'd run labs, and then what would be an example of homework for that person?
Well, that would be a very easy one. Most of those people know if they ate better, went to bed on time, and exercise, that they'd get better. But we would run the lab work, again, looking at the hormone balance, the immune system, overactive, underactive, digestion. Most people have, or many people in that situation have poor digestion. But let's take a tougher case. Let's take someone who came in the office one day and had just really looked depressed. And she'd been coming in for chiropractic and was, trying to get out of pain. And I said, "What's wrong? Why you look so down?" And she said, I'm 40 pounds overweight, Reed, and it's very disturbing. And, I keep wanting to help. I'm a big interrupter, to try to, cut the story. But her story had to be told. She said, I'm 40 pounds overweight, and it's very, very disturbing. I'm 40 pounds overweight because I've been on medication for the hives for 2 years, and it made me gain weight. And, again, I'm ready to jump in and save the day. Oh, no. She goes, and Reed, I was at the doctor's the other day, and I asked him, hey, I'm very disturbed by this 40 pounds. And, according to her, the doctor said, "Lady, you can be fat or you can have the hives."
Ouch.
Wow. And that was the answer. And she said, "Well, doctor, that's very depressing." And again, according to her, he said, "Well, I can give you a prescription for antidepressants if you'd like."
Of course.
And so now I know she's still staring at the ground. And I was walking her back to her treatment room this whole time. And she was going to get a chiropractic adjustment. We usually in the office would do some myofascial therapy, trigger point therapy around the neck, and put a heat pack on and get them real relaxed before the doctor came into it and make the adjustments and things. And I said to her, now we're standing over the table. And I said, "Well, first name, why didn't you ever try to find out why you get the hives?"
Hmm.
And her head snapped around so hard I could almost hear this. I thought, well, you're not going to need your chiropractic adjustment today.
Oh, right.
You're not going to need to get adjusted today. She said, "What?" I go, "Yeah, try to, we could find out why you get the hives, maybe." And so long story short, we sent her home with a couple test kits, found out that she was very sensitive to some things around her house, including some foods that she was eating every day. And lo and behold, within 9 days, she told me later, 9 days later, after the report of findings on that, she got off her medication and told her doctor, "I'm not taking this medication anymore because I found out why I get the hives." Again, I'm not truly certain exactly which of the things we eliminated out of her household care products, her personal care products, her food, diet, I think was the key.
Was it an elimination? When it came to the food, was it an elimination process?
Yeah. Elimination and focus on better foods that are non-reactive. So I could talk all about this kind of testing, but you asked for an example. that's just one of many that over 20 years ago let me know I was on the right track and that we were doing good work. If I could keep focused on underlying causes and conditions instead of just treating symptoms, that we would make some progress. For her to change her life around, I could give you more, just like a back to back to back with kids with asthma, kids with ADD, ADHD. I had a principal call me once who tracked me down through the mom and says, hey, this kid, call him Billy. Boy, Billy's a whole different kid. He's paying attention. He's not poking other kids. He's not outbursting inappropriately in class. He's just different kid.
Wow.
And then he said, what'd you put him on?
Oh my gosh.
So I said, well, sir, we did some testing. We put him on a better diet, a better bedtime schedule, a better exercise schedule, a better, sleep and all these things. And he just wanted to know what was the pill. So I said, I'm sorry, I don't have an answer for that. This is a lot more work than that. But I'm trying to point out that one case after another of doing the proper investigation into underlying causes, understanding how those react with each other or interact, which is, I think, forgotten. Even in functional medicine, there's not enough of that going on. And just the epigenetic factors, the lifestyle modifications, along with other things, feeding the cells, tissues, and systems everything they need and that's genetically required to function really well. At the same time, removing any interferences, blocking factors, and what have you, which are abundant. And so that's the methodology. It's kind of simple, really.
Right, but it requires, again, the patient to take an ownership interest and to do the work. And with the hyper, what is the word, trendy things like Ozempic and these diabetes weight loss shots that have come out, it just kind of reinforces this idea that your answers are in a quick fix shot or pill. So many people are not willing to show up for themselves in the way that you're talking about.
A good point. We have to do a pretty thorough screening of each potential client to make sure they're willing and able, because some don't have the wherewithal. Some don't have they're not stable in their lives enough. They're not sick and tired enough yet.
Right.
And I don't mean to laugh. It's not a funny thing, but it's kind of interesting how if you don't screen your clients, you could both be miserable. See, and I refuse to be miserable. I'm a happy guy. I wake up happy every day, thankful, very, very thankful. And so it's from that state of gratitude that I look for other people like that and they end up being thankful they walked in our office, and because they were ready and they were able and they could get a hold of some things. Other people, I'm telling you, it's kind of a shame, would write me a big fat check to get started and then not do anything I asked them to do. They just weren't able. And it's very rare I wrote them a check back. Again, I'm laughing, but I don't think it's funny. I just think I'm here to do what I'm trained to do, what I learned to do. And now I've taught others. So the joy I have today is not just in the amazing discoveries and work and methodology that formed out of all that, but the fact that I've been able to deputize other practitioners. And these are lay practitioners too, for the most part. About half are licensed nurses and all that kind of people, but a lot are nutritionists, and I call them lay professionals or fitness people, and who learn to use the laboratory work. And it's totally legit because we don't make any medical diagnosis. That's the farthest thing from our mind, is some medical diagnosis. I hate 6-syllable words, So it's a cluster of symptoms. Here's all the factors. Again, hormone, immune, digestion, detoxification. These are just imbalances and irregularities. They're dysfunctional, disease processes sometimes. But when you correct it at that level, mostly I don't like using the word lifestyle, but I don't know what else to say. It's epigenetics is the true word, but it's factors you can control for the most part. and you can. And we also use coaching formulas and techniques. So the reason I say that FDN, I'll end with this, the reason I say FDN, functional diagnostic nutrition, is a methodology. It's a method, steps to take, step by step, but it's the ology, that means the science of or way of thinking. So it's a method, yes, with a way of thinking about it, that there are underlying causal factors that have to be identified. So that's where the lab work comes in.
So your focus is now in still training others, and do they use your, like, is it a separate lab? So they're putting orders to your lab? Like, how is that working?
So I use various labs, and over the years they have changed. Some aren't even in business anymore that I started with, but I learned from brilliant lab people, like geeks working in the back of the shop, and the doctors who are out front, mostly selling it and promoting their work, which they were pioneers in saliva testing of hormones and urine testing of, all these factors, digestion and liver function and oxidative stress and on and on. So the labs are well curated over the 25 years I've been doing this now. And there's about 5 that I ask everyone to do on themselves to learn what's going on. And again, this is not medical diagnosis. So it's saliva, urine, blood, stool to see these healing opportunities. And then what do you do about it? What does the person do? So it's as simple as that. But no, I don't own a lab. I just use various labs who I have relationships with who understand how I work, how our system works. I have doctors that are our medical directors so that we can do all this and it's kind of a direct to consumer. I think I was the first one, or it might have been the second one to even do this kind of lab work for the population. People should have their data and own it and understand this your data.
Right.
This is your data. This is what's going on. This is what is out of balance or whatever it might be. And here's how you get to fix it. Not here's your pills.
Right.
Even though we do use supplements for support and stimulation and substituting for what food doesn't have anymore because it's not good quality food hardly, but and some self-treatment even for certain symptoms, you can do it safely and adequately with botanical things. So yeah, supplements are part of it, but it isn't just take this for that. It's you got to live yourself out of the problems you've lived yourself into.
Oh, I like that.
Yeah,
That's quotable.
Well, go ahead, take it. So you got to live yourself out of what you've lived yourself into. And so people coming to us, we're a lot like, you said, what if someone's just tired, fatigued, and overweight? Well, that could be a lot of things, mostly lifestyle. And you show them the lab work, and then they know what they're working on really. The hormones are going to be out of balance. The catabolic is something totally underrated by, I think, a lot of Western medicine. The catabolic condition, your cortisol is higher than your DHEA, which is, they balance each other out. One's catabolic, one's anabolic. When you're catabolic, your body's breaking down. You're getting old before your time, whether it's your skin or your liver. It just works that way. And then the dominoes start to fall. If you don't find the stressors and reduce them, manage them in some way, then the dominoes start to fall. The next thing to go is your sex hormones. Your estrogen and progesterone get out of balance. You start having weird periods, excessive bleeding, no bleeding, skipping periods, early menopause, infertility, all of these things. So with stress, you get catabolic, out of balance, and you start breaking down. The sex hormones fall right away. The next thing to fall, not necessarily in this order, but I could show you a circle and a pattern with the test results. I could show you all the data points. And it's not the points, it's how you connect them that matters, right? So catabolic, anabolic, sex hormones go out, libido goes down, your muscle tone goes down, your energy goes down. Your next thing to fall would be the immune system. secretory IgA, which is the main protector in the gut, can get reduced by stress. Just the cortisol itself has a direct effect. Stress has a direct effect on the immune system. So now it doesn't mean you get sick right away, but it means you'll probably get a dysbiosis. So the good and bad flora, because of the secretory IgA being reduced, the mucosal lining of the gut gets reduced, and you've got this dysbiosis, which is good to bad flora ratio. Well, when that's off, more bad than you want, this is a medical term, bigger, badder bugs. Bigger, badder bugs come along. I just see Dr. Tripp laughing because I mean no disrespect whatsoever. The bigger, badder bugs, worse, bacteria and funguses and other overgrowth starts to take a foothold. Why? Because it can. And that can produce its own symptoms. And with the dysbiosis, you don't have enough good bacteria to aid digestion. You really need that good flora to help break down protein. And protein contains, it breaks down into amino acids, which break down into eventually neurotransmitters. So now you can be sad and blue and not know why, and really have no energy. And then it just, again, the downward spiral I could show you in the labs ends up being, mucosal barrier dysfunction. And then you get congested liver, detoxification issues, and on and on. You could end up with autoimmune conditions. So the downward spiral is a very, very interesting phenomena when you use lab work to see it. You look at the data points and you can actually visualize when you know the anatomy and physiology, the biochemistry just makes so much sense. Lab work is about biochemistry, that it reflects, it paints a picture of the anatomy and the physiology, what's going on inside. You can see the villi shrink. You can see the space between villi, called the crypts, become flattened out. It's called crypt hyperplasia. And then you have low DAO, the diamine oxidase is in there to, break down your histamine, and you get all reactive. And, it sounds like I could really put you to sleep now, but it's really interesting to geeks like us,
Yeah.
Love it.
Do you have a question or anything?
Oh, no, this is great. I think it's a simplification of, I think, in Western medicine, and in integrated medicine, we're seeing, the analysis of all these pathways, and the culmination is the creation of medical pathways to address those. But in your hands, this is the simplicity and its expansion into the hands of and empowering people to do it is incredibly useful,
Thank you.
because I spend all my time virtually, or I'd say 80% of my time, trying to empower and to get the mindfulness and the awareness of the lifestyle factors in place for the patients in this time. As opposed to giving chemicals and drugs and kind of following the current paradigm.
Oh yeah, I feel you. Because the interaction with the patient, that's who you have to look in the eye and be forthcoming with, and not just give them the standard line, which is often not reality. You giving them the reality that this happened because of this, and because, here's the chain of how the dominoes fell. So in a way, you're saying it's your own fault. And physicians don't like to say it's your fault. Oh, there's nothing you could do about it. Here's your pills. They love to say that for some reason. I never say that. Those words don't come from our lips, because doctors are helpful. Their purpose is to help. And they've got the magic solution, and it's a system that's okay when they're relieving pain, and these, palliation is not a bad thing. Relief care is not a bad thing, but if that's all you do, the downward spiral isn't stopped, and you go from pills to surgery. I keep telling our clients, you don't have extra parts.
Well, what is one thing that you would like the listener to know?
Well, my personal prescription, if you will, is what I mentioned it. I get up every day pretty happy. If I'm not for some reason, I remind myself of how grateful I should be, because I'm one of the ones that woke up breathing, or just woke up, you might say, and you get to have a better day than yesterday, and you get to help someone. So I would say along those lines, having a purpose in life is one of the most emancipating factors. And if you don't have one, no wonder you're all stressed out.
Get one.
Yep, get one. I don't care what it is,
Try one.
Yeah. Yeah, no wonder you're all stressed out. You got no purpose in life. Yeah, everything bouncing off you, right? You guys have a purpose, I could tell.
Yeah. Yeah. That's cool. Okay. And then where can the listener find more about you?
Oh, yeah, let me make sure that we give out, if I have it here. Usually we create a special URL for listeners to go to, and it's fdntraining.com/infinite health, in honor of your podcast title. So fdntraining.com/infinite health would be a good place to go. And we'll give you something there for free. You don't have to buy anything, not selling anything, but it's a place you go get something. I'm not sure, frankly, what it is today, but it could be a little manual. It could be a little mini course in something. And
Awesome.
it's something for fun, to appreciate the audience very much. And you guys, thank you for the amazing work you're doing with Infinite Health. It's a great purpose.
Thank you so much. And I'll have that link, audience, in the show notes. So if you didn't write it down, don't worry about it. It's in the show notes. You can look it up. All right. Well, I really appreciate that. I learned a lot. I think your explanation of the labs, like I've never really thought about it before. So it was very helpful. So I appreciate that.
Yeah, you're most welcome. Anytime.
All right.
Awesome.
Well, listener, I hope you found this informational, educational, somewhat entertaining. And until next time.
Thanks for subscribing to Your Infinite Health. I'm Dr. Tripp.
And I'm Lene. Until next time, feel it, look it, and live it.